Okay. Well, good morning, everybody. I'm glad you all are here. Not that the man needs any help from me or an introduction from me, but it's been suggested if I introduce the mayor, it would be a good thing, and I'm really honored to do that. And let me just say one important reason why I am honored to do it. The work that DC Appleseed has been doing now for almost 10 years, addressing the HIV/AIDS epidemic, could not be done without the cooperation of this mayor and the other key people from this city who are sitting on this front row. And we're very appreciative of the way they have worked with us to allow us, as the mayor just said to me a minute ago, to keep the city's feet to the fire. And that's the purpose of this report card and the original report. And I'm pleased that starting with Tony Williams and then Adrian Fenty and now Mayor Gray, all of the mayors since we began this work have seen the value and the benefit of working closely with Appleseed so Appleseed could continue to bring visibility to what remains to be done. And so I'm very pleased that the four of you are here, and particularly that the mayor himself is here. And so it's my great pleasure to introduce the mayor of the District of Columbia.
Thank you very much, Walter. I want to thank you also for your vigilance, your diligence, and your continuing commitment, not only just on this issue, but so many others that you have provided leadership on, through DC Appleseed. I've been to many of your events. I've been to efforts, that you've put together around a variety of issues, and you are the moving force. And I don't have any reservations about saying that. And I want to thank you for your continuing focus to this issue in particular, because while we've made a lot of progress, we've got a long ways to go. And I think it always helps, even though it doesn't feel good all the time, it always helps to be able to have an external validation, if you will, or lack thereof, of what it is that we are doing. I think this report card acknowledges the advances that we've made and also acknowledges the continuing challenges that we have in addressing this dread disease. And I think, as it has done before, it will help to chart a path forward as we continue our efforts. I want to acknowledge our council member, who you will hear from shortly, who is here. She, of course, chairs the committee on health at this stage. Councilmember Yvette Alexander. Councilmember, thank you very much for being here. I want to acknowledge Dr. Garcia, who is here. He's our still new. I don't know when you stop being new in these positions. It just falls off one day. There's no particular day, no particular time, but we'll still call you new, Dr. Garcia. And Dr. Garcia has done something on another front too, and that is connect us with the Clinton Global Initiative that will facilitate our continuing progress on infant mortality in the city. Our last report, not to get all off on that, but our last report showed that our rate had dropped to 7.4 deaths per 1,000 live births, which was a substantial drop from the previous year, 69 deaths among infants who had not reached the age of a year old. We think, Dr. Garcia, the efforts you have made to connect us with the Clinton Global Initiative will help us continue our substantial progress. I want to thank Michael Carfin, also, who is a longtime worker in the vineyards and really has taken on a role of leadership with HOSTA at what is a critical time for us, which I don't know if there isn't a critical time on an issue like this, but Michael, I want to thank you for stepping up and really bringing that expertise and leadership to this issue. I guess it's now 8 years, 10 years since the first Appleseed report. I think you said 10, right, Walter?
We've been at it 10 years.
Yeah.
The original report was 05.
Okay. So that is right, 2005, which you would know better than me, to be honest with you. Actually, the 2005 report showed failing grades in a lot of areas, and I think the fact that this report is being done in and of itself has impelled people to, and compelled people to do more on this issue. although just the disease itself should be enough. The seriousness of the disease should be enough to be able to move us forward. Today, I'm pleased to recognize that our grades have really substantially improved since 2005. We've come a long ways, and we've got a ways to go, as which I readily acknowledge. Since 2005, we've made improvements in leadership. We've made improvements in testing. The testing has really increased significantly. In fact, one of the things I do is I get tested annually and immediately publish the results, so that people know that that is a good thing to do, and that publishing the results should facilitate other people hopefully being motivated to get tested. Condom distribution, there's been major improvements there, partnerships and collaborations, and also in syringe access services. Although we continue to face the threat of riders being imposed on our budget that would forestall our opportunities to be able to continue this program. Pretty amazing, isn't it, that we have people who would not see the value of this, or because of their own ideological positions that they can't impose wherever they're from, they try to do it in the District of Columbia. And there was a long time before we could use our own public resources to do that. We had Prevention Works. Everybody remember Prevention Works? It was a private nonprofit organization that raised money in the private sector to be able to have a needle exchange program here in the city. And then we finally were able to get rid of the rider, and we were able to then introduce and incorporate into the city services a needle exchange program. By that time, I think there were 200 or more other cities that already were doing it. I think it was the city of New Haven that was the first to have a needle exchange program, and certainly proved the efficacy of doing that. So that was one where we were late in the game, but through no fault of ourselves. We've continued to try to make significant investments in this epidemic, and we think that that is reflected to some extent in the grades that we receive today. One of those investments, and we will continue to make it, is in the Mayor's Commission on HIV/AIDS, trying to bring the best, best and most committed people we possibly can to this issue. And we are expecting more work from the commission that is in place now. We recruited new members. They include frontline workers, public health professionals, people living with the virus, program experts, clinicians, just a host of diverse people who share the commitment to being able to solve this problem. As most of you know, I think we established three overarching approaches, initiatives, commitments. That is, one, to be able to treat the whole person rather than have this distinguished and put off to the side as if it isn't related to other health conditions. And then creating a treatment on demand commitment, and we are making progress in that regard. There are some things too that we've accomplished that I want to just cite, and that is we now have multi-year evidence of the fact that the number of new cases decreased between 2007 and 2011. We cut in half from over 1,300 new cases to 700 plus new cases by 2011. We've gone from having linked barely half the people to services within the first 3 months after diagnosis to now 80% of the people who are diagnosed being linked to services within 3 months. And of course, the goal has to be to reach 100%. You've not made the kind of progress we want to until we can say that everybody has that opportunity. The number, and to go back to syringe efforts for a second, the number of new diagnoses attributable to injection drug use has decreased since 2001. Over that 10-year period, has decreased by 80%, which is a phenomenal accomplishment, because there was a time when injection drug use was rivaling sexual transmission for which one was going to be the most predominant method of transmission, and that is substantially reduced, which of course is a good thing. The number of deaths between 2007 and 2011 has decreased by 41%, and the number of tests, which I think is one of the most important things we can do, has increased tremendously. We had, in 2012, we had 138,000 publicly supported HIV tests. If you go back to 2007, we barely had a third of that. We had 40,000 tests conducted, and people have realized now the importance of getting tested, and then, you know, depending upon the results, doing something immediately with that. And then, sixth, the condom distribution program has increased tenfold since 2007. In 2012, we had almost 6 million condoms that were distributed here in the District of Columbia, which is yet another important prevention approach. I think one of the most important things, too, is that, and it's pretty amazing, I think we had our first case of AIDS detected in 1983, so 30 years ago. And in 30 years, which in some respects is 30 short years, we have made so much progress that this is no longer a death sentence, that even people who have full-blown AIDS can live productive lives and don't feel like it's a question of the countdown on the calendar because of the improvements, especially in pharmacology across the nation. So quality of life has improved tremendously, and we're proud to be a part of that. Quality of life has improved for so many people across the nation. So, Walter, I wish we would get an A+ in everything, but I also know with your exacting standards that will probably never happen. And that's okay, because it always gives us something to which to aspire. I think if we got an A+ in everything, unfortunately, human behavior being what it is, complacency would set in. And I'm absolutely sure that complacency will not set in, certainly with our continuing challenges that you've identified. We know that that the infection itself and the disease, AIDS, continues to affect everybody, all populations, I should say, in the city, irrespective of age, race, ethnicity, or gender. But we also know that it continues to disproportionately affect African Americans in the District of Columbia, and that's something that we are going to increase our attention to. Again, I'm very grateful for the attention paid to this issue by Appleseed, which is one among a number of issues that you all have targeted, all of which, Walter, have an important role to play in the quality of life in the District of Columbia. And certainly this may be at the top of the list, given the consequences of failing to pay the kind of attention to this that we should. So let me say again thank you to you and to DC Appleseed. As we do every year, we take very seriously these results, especially in those areas where we may not have done as well this year as we did last year. How do we redouble our efforts to make sure we come back at least to where we were? And in those areas where we did improve, how do we build on those gains and continue to move forward? So with that having been said, I want to ask our council member if she will come up. She, of course, now has responsibility for the Committee on Health. Please join me in welcoming Council Member Yvette Alexander.
Thank you. Good morning. You know, Walter, this report card looks pretty good. I think I would be kind of proud to present that to my parents, with the exception of the C's and a couple of the B minuses maybe. I would have to stay in a couple of weekends and study. But overall, and Mr. Mayor, you're right. I remember in the 80s when this was a death sentence for so many people when they got the diagnosis. So I'm really pleased with the progress that we've made over the years, and some of the thinking out of the box that we're doing with HIV and AIDS. We're now reaching out to churches, which churches didn't speak about the disease, and now churches are reaching out to people. And it's so important because I think all of us in this room even have been touched by HIV/AIDS in some form or fashion, whether it be a friend, a family member, a neighbor, a coworker. We've all been touched by it, and the epidemic in the District of Columbia alone, we've all been touched by it. And I know I'm passionate about it, and I know everyone in this room, all the hard work that you do. But I'm really pleased with some of these results, and I just want to speak on some of those C's that I know that it's going to be my challenge and my charge, along with Dr. Garcia, to work on these issues. But as far as some of the out-of-the-box thinking, who would have thought you could get tested at Department of Motor Vehicles? So we're doing that now. I'm really excited about that. Our senior population, our seniors, at one point, that wasn't thought of, that seniors would even have to worry about this. But our seniors are growing with the diagnosis. So we have to make our seniors aware, along with our geriatric physicians, in terms of testing. I reach out to our physicians and say, no matter how old your patient is or how young your patient is, you should offer the testing, or you should definitely do the testing. So I'm working with the Board of Medicine definitely to let them know this is a routine part of your physical examination. This is a routine when you check for hypertension and diabetes and cholesterol, high cholesterol, you should also be checking for HIV/AIDS. And we're doing that more if you look at the testing. Testing is all around the city. Mobile vans, and Mr. Mayor, I know my status too. And I do get tested, and I serve as an example for the residents in Ward 7, because a lot of them need to, you need to lead by example. So when our elected officials get tested, it will follow that our constituents and the residents of the District of Columbia will get tested too. If I start naming names, I'll get in trouble, but 3 names do stand out. Of course, Whitman Walker Clinic with all their work. We just had the AIDS Walk just recently, and they do a great job in this city. And for our women, because among women, the disease has grown too. The Women's Collective and Patricia Knowles, she has been phenomenal in her efforts as far as working with our women who have been diagnosed. And we had a superstar, a megastar, a songstress, Alicia Keys, who actually, it was interesting that she really focused on developing countries with their HIV/AIDS populations, and she did not realize that some of the stats in the District of Columbia were synonymous with with some of the stats in our developing countries. And she committed to come here. She reached out to United Medical Center, and she really came. I was surprised. I was there, and she came in to talk to a small group of women who had just recently, about 10 women who had just recently been diagnosed. And she reached out because she made a point to say, I never knew that right here in the United States it was, so far reaching. And I was reaching out to other countries, and it's right here at home. And she really, really passionately reached out to the ladies there, and she's committed to working a partnership with United Medical Center and in the District of Columbia. So it's efforts like that that bring attention to HIV/AIDS and bring awareness to HIV/AIDS. I just wanted to mention it's really important for that housing component, because I see that grade was a C+. And it's really important that we house, a lot of our residents who are suffering from HIV/AIDS, who are not able to work at this point, who are not able to care for themselves. Supportive housing is so crucially important. And along those lines, we also know that HIV/AIDS now is manageable. People are living out a full life. We really need to monitor that and make sure that persons are not abusing the housing initiative as well. So I'm really going to champion monitoring housing to push for more supportive housing for our residents who are in need of that. Are there any other C's that we need to touch on? DCPS or monitoring and evaluation. And that's really important because we need to know our stats and we need to know where people are and what's going on. So we really need to brush up on our monitoring. And as far as our charter schools, I would love to see, I would love to see across the board that our traditional and our charter schools are doing what they need to do. It's really good. I understand that there is condom giveaways in our schools. Most of our schools have a school nurse. Testing is available there. Counseling is available in our schools because our young people really need to be made aware. Our young population is growing with receiving the diagnosis. So there needs to be an education piece definitely in our school system. I want to commend Dr. Garcia. I know there's been a change of the guard since I've been the chairman of the Committee on Health, but we need to keep that continuity going and focus on our chronic illnesses. And I'm committed to work with you and the mayor that we can eradicate this disease. And I look forward to some better grades, but I love the report card because it lets us know where we are. And you've been brutally honest with this report card, and I thank you for that. But I want to see straight A's across the board and keep it that way. Thank you. Thank you, Mr. Mayor. Oh, and it's exciting. I'm sorry, Mr. Mayor. Another Unity Healthcare, and I know I'm going to join the mayor with the ribbon cutting there. And it's so important to have access to care and access to testing. So I know that Unity Healthcare is going to be another avenue in Ward 7, definitely, that we can prevent HIV/AIDS, and the treatment component will be there too. So I'm really excited about Unity's opening in Ward 7. Thank you. You too.
I think the ribbon cutting, is it today? I think it's today, isn't it? Yeah. That will be very exciting because it's a brand new clinic that will make primary care services available to people. I know we've had the Hunt Place Clinic heretofore, but it never was the state-of-the-art kind of clinic that we will have now. And you mentioned charter schools. That is quite a challenge because charter schools, as you well know, are autonomous. They don't operate under any kind of central governance system. But we now are working more closely, Walter, with the charter schools than ever. The executive director, Scott Pearson, is a part of the Public Charter School Board, is a part of our education team. So we will work through them. I think what we will do is, and I know there have been efforts like this in the past, but we will make sure that those areas that we maybe fell off a bit or where we certainly need to continued improvement, we'll try to provide feedback within the next few weeks exactly how we are, and we'll continue to address those issues to effectuate improvement. And of course, the person who will have principal responsibility for that, although we're all involved in it, is our health director. We are delighted to have Dr. Garcia with us. I was in a room with him recently with a group of people who put on a reception, and boy, what a commanding presence he has, and what a high level of respect he has among lots of people across the nation. So let's hear from our health director, Dr. Garcia, and then from Michael Carfin thereafter. Thank you, sir.
Well, good morning, everybody, and I want to thank Walter for the work at DC Appleseed. For the people that do not know me, when I met the mayor, the same way that he was talking about infant mortality, he has, and I have been in the DC area for more than 10 years, and I have seen all the growth and development in the last 5 years in terms of the improvement. You can see cranes everywhere, and you can see all the economic development that is happening. And then you heard about the improvement in education that we have in the district. So when I met with him, I was not expecting to have a leader understand so much about the disease and the depth of the knowledge and also the passion. I have worked with presidents, I have worked with senators, I have worked with governors. I have never met a leader that I worked for that knew everything about the disease and the passion to work for it. So I want to publicly thank you for your leadership. I'm not supposed to disagree with Walter, but I thought that that should be an A in leadership because I have never seen what is being done here in D.C. in the rest of the nation. As a matter of fact, I come from Connecticut, and I have to tell you that when we started the the needle exchange, it was a very political thing, and I'm an OBGYN, so, but what the way it has been done here, that we have reduced by 80% the transmission secondary to IV drug use, no other state, no other jurisdiction in the nation or in the world has ever done it. And you can quote me on that one. This is something that DC should be very proud, and the mayor should be very proud, and everybody working, including the chairwoman from the health committee. I think that the health department should be very proud about all that work that they have done. And I agree that there's some things that we have to do better. We were talking in the agency in terms of the importance of the Affordable Care Act and some of the tools that that would give. We are in the agency, Mr. Mayor, we're talking about the Affordable Care Act talks about patient-centered medical home. In that way, services support the patient and work with the patient, go with the patient. We are talking right now of patient-centered medical home for HIV. And we are in the early stages in terms of how we can do it. As soon as we have it, we will present it to you. And Michael Carfen has taken the leadership in the interim way right now for HASTA, and he has done a marvelous job. I really thank you. There's been a lot of improvement in the ways that we have been dealing in the agency. Again, like the mayor said, we have reduced by 50%, close to 50%, the incidence of HIV. Again, I used to be, and this sounds a little egomaniac, but I used to be the highest public health officer in the nation. So when I talk about public health, I think I know a little. And when I see what they have done here, I mean, it's second to none. And it's the capital of the United States. For me, that means it's the capital of the world. So what we are doing here with the help of DC Appleseed and the council, I think, and the leadership of the mayor, I think this can be a benchmark for eradicating HIV nationwide and worldwide. And that's the goal that we have, starting first with our people here in the district. And Ward 7 and Ward 8, it's a challenge that we had to work. We want to put a lot of efforts also in some of the subgroups. Males, African American males, is a challenge that we have to continue working on, fighting to eliminate there. But like it was mentioned before, this is a chronic disease now. So we cannot single the patient just because of HIV. Now we have to realize that when it's a senior with HIV, it has other 6 or 7 medications. So we have now to support those patients with. And I look forward to continue working with the team of the mayor. I think in the next few years, the mayor probably is going to continue reducing this for another 50 and 80% per year. And I hope that when in less than 3 or 4 years, when the mayor stands here and look at the grades, all of them are A+. But I was going to even put the A+ myself there in leadership because I had to tell you, it's really a treat for me to work with a person that cares so much for his people and also for the disease and the eradication of them. Thank you, sir. Thanks.
I heard that, Dr. Garcia, when the mayor checks in 3 or 4 years.
Good morning. Thank you, Mr. Mayor. Thank you, Councilwoman Alexander, and thank you, Dr. Garcia. I really also want to echo the leadership that we get here in the district. As I said at a recent press conference when we released our new statistics, no other jurisdiction in the country where the mayor releases new statistics on HIV and AIDS or personally co-chairs a commission, his own commission. So his personal investment in it, Councilwoman Alexander's investment in it, and of course our new Director of Department of Health, and the team that we have at HASTA, which I really credit for their efforts. I also thank DC Appleseed. This is 7 report cards that we've worked together. So to see the advances that we've made,
and also the areas that we continue to work on. This disease continues to change. It continues to affect different populations, and we need to be as flexible and nimble as we can in our response so that we can be as effective as we can. And working also with to create a continuum of care. We've had a core strategy here in the district around expanding HIV testing so we can diagnose people earlier in their infection and connect them to care, keep them in care so that their virus is suppressed and they can stay healthy, as well as we've learned, that science has told us, it reduces the chances of new transmissions. And we've seen that, that accomplishment over the past couple of years to see how effective that strategy can be, as well as large-scale efforts like condom distribution and needle exchange, and efforts around working with our young people. I really do think that though we have lower numbers of HIV among youth in the city, there's a growing number among in our set and 20s and in this, which we are flagging as a concern because it could very well be adolescents who are growing up and now becoming more at risk of HIV as they get into an older group of population. So we have an opportunity to create an HIV-free generation in the district, and that can help those young people be able to grow up healthy for their entire lives. And that's going to require a tremendous collaboration among our government, our community, our school system and educational system, and that's our entire educational system, both our public schools and our public charter schools. And that, I think, can really achieve this HIV-free generation. So I look forward to continuing to work with DC Appleseed. There are areas that we note that we need to improve on. That's my mission in the next couple of months to get those accomplished, or in substantial progress to that. And thank you again, Mr. Mayor, for your support for our work for the residents of the district. Thanks.
I'm not going to let you go without me saying a few words, especially since a word in response may be called for here. I just want to say that I remember last year when we did this, and I stood up and said, it isn't really the grades that matter, it's the progress that's being made. And the mayor got up and said, no, it's the grades that matter. And he told me he had averaged the grades, and he knew exactly what the grade point was. And in a way, I guess DC Appleseed is pleased about that, because to the extent what we are doing provides incentive and a spur and visibility to the work that remains, then we will have accomplished what we are trying to do. The other thing I'd like to say is I think the key to all of this is what Michael Carfin just said. It's collaboration. The only way this epidemic is going to be ended in this city is if all of the key stakeholders work together. And I'm very pleased that there's evidence of that in this room today because the representatives of the key stakeholders are here today. Before I just comment quickly on the areas of challenge, because some of you have mentioned this, I want to just say a word of thanks to some folks who make our work possible, starting with the Washington AIDS Partnership and Channing Wickham, whose idea this work was from the very beginning when we started 10 years ago. And without the support of Channing and the partnership, none of this would have happened. I'd like to thank the law firms that have worked with us. You know, the mayor said a minute ago that DC Appleseed works on a number of things, and that is true, but we're actually a very small organization. Our reach is great, Mr. Mayor, because of the pro bono support that we receive year in and year out from professionals in this city, including from Hogan Lovells, who's worked with us on this for all 10 years we've been at it. Paul Weiss, who's worked with us on the educational elements. We even have a spectacular fellow, Rob Stout, who has done this graphic work for us, pro bono. So if you need someone to do graphic work for you, Terrapin Studios, you may want to talk to them. We also were supported more recently by AIDS United. Channing helped us get a grant from them to do some of the work we're doing with Harvard right now. Robert Greenwald at Harvard with regard to how the Affordable Care Act is going to be effectuated with regard to people with HIV. So the work that we have done and want to continue to do, we do because we have the support of people like that, and many of them are here in the room this morning, Mr. Mayor, and I want to personally thank them. I also would like to say, good for you all for saying things I don't have to say now, The progress that has been made with regard to this epidemic since we began work at the end of '03 and when our report was released in '05 has been absolutely spectacular. And a lot of people are due a lot of credit for that, primarily the collaboration that came together to get this done. But even though we have raised grades, and you know what they are, some of the most effective tools available in addressing this epidemic, we now give A's in. HIV testing and the syringe access service and the condom distribution are now cutting edge and a model for a lot of people in the country. And I salute the city and those they're working within the city to make that happen. I just want to mention 3 areas, and I love the word all of you use, 3 areas of challenges that remain, because the glass, I believe, is both half full and half empty. If we're actually going to celebrate the fact that last year we only had 718 new HIV cases, we also need to lament the fact was that last year we had 718 new HIV cases, which we should not be having. And it's going to take, I believe, Mr. Mayor, the city working with all of its partners, making A-pluses in every category for a sustained period for that number to go to 0. And I welcome the day DC Appleseed can get out of the report card business and move on to doing something else. But until that day comes, I'm happy for us to have the opportunity, and I think it is a good opportunity, one where we can play a constructive role in helping make good things happen. So let me mention 3 areas of challenges. That's the word you all use, and I think it's the right word. And there are 3 areas where we actually lowered grades this last time. And Councilmember Alexander, there are some C's to talk about here. And the first one I want to mention is the charter schools and the role of OSSI with regard to the charter schools. And yes, as others have said, the charter schools are autonomous, and they need to be autonomous, and the fact that they're autonomous allows them to do more creative things than others might do and contribute to education in this city. But when it comes to having effective HIV/AIDS education in the charter schools, it has to happen. And the law requires it to happen. The Healthy School Act demands that that happen. And the work that we have done so far shows, to us at least, that the kind of effective, systematic education of young people in the schools, in the charter schools, with regard to HIV/AIDS education is still not happening in all of the schools the way it needs to be. And I believe that's part of the challenge for this coming year, and I would love it if next year that is an A. And I think the Charter School Board has a role to play, the individual schools have a role to play, and OSSI itself has a monitoring role to play to make sure that that happens. So I hope that this C, Councilmember Alexander, is a spur going forward, because not only do we owe that to the young people in the schools, but something Michael mentioned shows how critical it is that we do that. STD numbers are up among young people, and the percentage of young people now among those who are the new HIV infections is the highest of all of the percentages. So something is happening here, and we need to be addressing it. Can I also talk about leadership for just a moment? If I were grading just this man over here, I would give him an A+. But our concern with regard to leadership over this grading period had to do not so much with the mayor, but with the key role that HOSTA plays. And HOSTA plays a key role in working with all of the community providers and the CBOs and the service providers. This epidemic is not going to be addressed unless we have the collaborative process that Michael Carfin was talking about. And based on what we saw over the last year, that was not nearly as effective as it has to be in order for this collaboration to successfully occur and address the epidemic. Now, we are heartened, and we said so in the report card, that Dr. Garcia and Michael Carfin are now here. If we could give letter grades based on the great things we expect, we would have given an A. But that's not the way we grade. I don't think any of you ever got a grade based on what they hope you will do next week. And if you had such a teacher, then good for you. You were luckier than I was. We expect great things from these two gentlemen. And great things are needed here because things are getting harder, not easier. With the ACA and with housing needs and with the changes in Ryan White and the need to make sure that the people in the community understand the vision of the district government and how the district government is going to cooperate is critical. And if the good things that I expect from these gentlemen happen and the mayor offers the sustained leadership he always has, I hope that will be an A next year. The last area I want to focus on is a little wonky, but it's critical. It has to do with the surveillance and the monitoring, which again, Councilmember Alexander mentioned. And although this is a technical field, it's crucial because what these two areas are about is gathering up-to-date data, making sure it's accurate, and then determining how you marshal that data to effectively address where we are right now. And these are areas where, as I know Michael knows and Dr. Garcia knows, there's been a little slippage in the last year, so we graded down slightly. I'll say on the other hand, surveillance, when we began this work, surveillance was probably one of the worst things in the city. No one knew what the numbers were. No one knew how to marshal the numbers. There was a box of papers over there, and down the hall there was someone who knew something or another. Now we're methodical. Now we understand how critical data are. And what I would like to see, what DC Appleseed believes is critical in addressing the epidemic is we have up-to-date data that is successfully marshaled, and once we know what it is, we use those data to target where we're weakest. So we make sure we're getting at this epidemic where we need to be getting at this epidemic. So those are the three areas we graded you down. We graded you up in certain other areas. Mr. Mayor, if you average all of these grades together, you'll find you're still up over 3 point. If next year it's at 4 point, I think we'll all be able to celebrate. But to do that, it's going to take everyone in this room and the organizations represented by people in this room working together to address this epidemic. And as you say, we have a long way to go, but I am confident we're going to get there. So I appreciate everyone's work, and we'll be grading you again soon. Mr. Mayor, you want to take some questions from some of your friends in the media?
Whoa, watch yourself, Walter.
Okie dokie. Yeah, well, it's yes, if that's the way you look at it. That they may, I think it's a little misleading to look at it that way because some areas are probably more important than others. There's overlap among the areas. But yes, if you do an average, Mr. Mayor, and then divide by the total number, it's down slightly overall. But I would say this to you, Kavitha. We also grade harder every year. In other words, we believe that each year more needs to be done because we've learned more and the capability to address it should have grown some. So we get tougher all the time. It's harder to get an A every time. And if we were giving all A's, to go back to something that the mayor said, I believe we wouldn't be having the incentive that I think the lower grades actually produce. So look on the bright side, there are more areas that need to be improved, and they now will be improved.
I don't think people would believe it was very rigorous or that we had accomplished all that if we got an A in every area.
Right, right. Well, I would take the Can I just say one thing before? I believe that if you look at our grades over time, and in your report card there's a chart that shows how grades have changed over time. At the beginning of our work, DCPS was among the worst. I think we gave a D at some point to the schools. And these things take time to change. I believe that DCPS has responded favorably, not that they live and die by our grades, but as we have measured them snapshot once a year for these 8 years, DCPS has made remarkable progress in getting things in place. Last year was the first time that we were specifically expressing discouragement about the charter schools, for example. And there are charter schools, individual charter schools, who have responded, I believe, to that favorably. The reason we haven't raised the grade yet is because it's not clear to us yet that the systematic, across-the-board approach that we think is needed has been put in place.
I think one of the things that was inherent in virtually everything that was said here today, and Walter directly put his finger on, and that is collaboration. And that is never more evident when we're talking about the schools. We've done more to bring healthcare services directly in the schools over the last several years. You know, I think every school now has a nurse. We have mental health services in probably 50 to 75% of our schools. And that's where the emphasis is going to have to be, you know, continue to be focused. I think also us taking this opportunity to respond to this ourselves and say, all right, we accept this, and it won't be any defensive response either. It will be to look at where the areas of improvement have been needed, have been cited as needed, and to say, here's what we're going to try to do. Here's what we're going to work on between now and the next time this report card is done, which also, Walter, will give you a chance to say, you know, to grade us on whether we did what we said we were going to do, which I think is helpful too. Well, I think if you look at some of the data, though, the data have changed. If you look at the number of tests, for example, that were conducted, you know, I think there were 16,000 more tests that were conducted in the city between the last time we reported and this time. That is a significant advancement to me. We've made some advances in terms of the commission and what the commission is focused on. So, you know, to the extent if you'd like to drill down on those things, we'd be happy to do that. But I don't think the grades may, in some instances, be the same, or we may have gone up a little bit, we may have gone down a little bit. But I think if you drill down on the data, you're going to find differences. And to the extent that, for example, in education, that we haven't done the things that we believe should be done, they believe should be done, we are going to focus on those. I don't think there's a leader who is worth her or his salt that will look at a grade of C and feel good about it or simply discount it. We certainly aren't. So again, I think, again, not to be redundant, but I think if you look at the data, even though a grade may be the same in some areas, the data indicate that we are going north on some of these issues.
I might say, when you look at data, when you look at data, you cannot just take one piece of data because that would be a picture. So you want to see the movie, and that tells you the story. So the movie will be the trend. So the trend here is more testing, more response to the DC Appleseed recommendations, and then lower incidence with related to needles and so on and so forth. So you have to look at the trend. That's what tells you how the process is going.
I think, too, again, looking at the data, when you see a continuing decrease in the number of new cases of people who have contracted the virus, that is one of the most important pieces of data to me. And again, I agree with Walter. Isn't it wonderful to be able to say we're down to 718, but isn't it awful that we still have 718? That's the you know the two-sided coin, if you will. So we know we've got challenges, you know, facing us, but I think we're going in the right direction. You know, the leadership issue was discussed at the Department of Health. I think we've got two excellent leaders there. It's important that they be a part of this discussion. And frankly, they're being charged at this stage to say, all right, these are the findings. What are we going to do to have those findings look differently in November of 2014? Tom? Okay. All right. Thank you all very much.